Irritable bowel syndrome, or IBS, is a digestive disorder involving abdominal pains and cramping, as well as changes in a person's bowel movements. IBS symptoms vary from person to person, and there is no clear diagnosis as to why patients come down with it. Almost anyone can come down with IBS, but candidates typically include people who are under a lot of stress, have poor eating habits, and rarely exercise. Since there are also no tests to determine if a person has come down with IBS, doctors have to rely on tests to rule out other possible diseases and problems. Even though symptoms vary from person to person and range from mild to severe, common symptoms include abdominal pains, fullness, bloating, and constipation or diarrhea that has occurred for at least 6 months. Usually the symptoms will lessen or go away after a bowel movement. People who come down with IBS often lose their appetite or choose not to eat in order to reduce the amount of stool they pass, but this just weakens the body and can worsen the symptoms. As far as diagnosing IBS goes, even though there are no tests to determine if a patient has IBS, there are other tests conducted to help rule out any other diseases. Blood tests help rule out a patient who may actually have anemia, while stool tests rule out infections. Additionally, colonoscopies are given to people who are over 50 years old, have sudden weight loss or bloody stool, or have abnormal blood testings. Other similar diseases often mistaken for IBS include celiac disease, colon cancer, Crohn's disease, or ulcerative colitis. In the field of treatment, the primary goal is to relieve the patient of any occurring symptoms. Fiber supplements will worsen symptoms, and laxatives become habit-forming. Prescribed medication varies for all patients, but doctors will often urge patients to take anticholinergic medication such as propionate or Buscopan about half an hour before eating to control colon muscle spasms. Loperamide and lubiprostone are prescribed to treat diarrhea and constipation syndromes. Irritable bowel syndrome may be a lifelong condition. For some people, symptoms are disabling and reduce the ability to work, travel, and attend social events. Often changes in lifestyle will help relieve symptoms. For example, exercise and improved sleep habits will reduce anxiety and relieve bowel symptoms. Avoiding food containing caffeine, rye, chocolate, and milk reduce intestinal stimulation. The most important thing to note is that IBS does not cause permanent harm to the intestines and does not lead to a serious disease such as cancer. Remaining positive and learning to cope with IBS can actually help relieve symptoms over time.